Developing right now, a seventh death linked to the Legionnaires outbreak in Harlem. This comes just a week after the last reported death.
And the bacteria now detected at an EMS station also in central Harlem. Pix 11's Kalarama is there this morning with details on both developments.
The water supply here at EMS Station 16 testing positive for Legionella. The issue is it's co-located with Harlem Hospital, which was already supposed to be sanitized and good to go after being found positive for the initial outbreak here in central Harlem. An FDNY spokesperson saying, completely out of an abundance of caution and not at the direction of health officials, FDNY started water mitigation procedures at EMS Station 16, following water samples from inside the building that tested positive for Legionella bacteria. But the city's health department said there's no reason for alarm, despite Harlem Hospital testing positive as part of the largest outbreak in more than a decade. In fact, the health department said this site is not under investigation and has no indication of an increased risk to Legionnaires' disease at this facility. This is not related to the health department's investigation of the Legionnaires cluster in central Harlem, and this does not pose a risk to the community. Meanwhile, there has been a seventh death in relation to the central Harlem outbreak, with 114 confirmed cases and 6 people hospitalized. The city said all 12 cooling towers related to this outbreak across 5 central Harlem zip codes have all been sanitized. Those locations include a retail center on 125th Street, a CUNY College Science Building, the Harlem Condo Center on Lenox Avenue, and Harlem Hospital. City hospitals are supposed to test for Legionella bacteria every week. While the health department says Legionella in the environment is common, Legionnaire's disease is not a common disease. Among 8.5 million New Yorkers, between 200 and 700 people are diagnosed each year. This disease only spreads outdoors from water vapors of a cooling tower, not a plumbing system. And it can also not be spread from person to person. Anyone with flu-like symptoms are urged to get checked out, especially if you work or live here in central Harlem. The FDNY confirms as of right now there is not one single member of the FDNY who's tested positive for Legionnaire's disease. In central Harlem, I'm Kalarama, Pix 11 News.